High blood pressure, easy. What's your blood pressure medication? When your blood pressure comes down here, you're on a lot of diuretics here. Kidney number 2 is a diuretic, a little diuretic in kidney number 1. Use those to clean and restore the kidney function. At the same time, it'll help keep the water off, get your body out of acidosis. Pulling the lymph will get rid of the herpes, and you're in good shape. How about that? Langs Brenda. Hi there, Dr. Morse. Hi, sweetheart. Diagnosed with diabetes and put on metformin. And yet the doctor says I do not need to keep an eye on my blood sugar. Yeah, don't. Well, that's unusual because really most doctors says we'll just watch it. So, I know. You know, it's very common for a medical doctor because he sees everybody on the 15-minute or less. Less than most of the times here. How's he going to know you and take care of you? You know, reality is that you're stuck on medications and you'll be on them the rest of your life because they're not going to take you off of them. I mean, there's some good medical doctors that maybe watch and do that, so forgive me, but what I see here, people come in here, they've been on medications for years and didn't need them, and the medical doctor didn't do a thing about it. It's like, that's not good. You have to take responsibility because as a practitioner, I'm going to have you on an herbal program, but at a certain point, I'm going to get you off of most of them and go on. If you need something, we're going to keep going. We're going to work on that or not. You know, we're going to change things around. We're going to deal with that. The idea is that your food be your medicine and your medicine be your food. And so that's the whole idea. Unfortunately, we don't have any good food. So I don't know. But anyway, you know exactly that was wrong. Good take, Brenda. Can I call you Brenda? What on earth is that about? Well, you know, don't worry about it. You're covered. That's crazy. That's insane. Because what happens if your blood sugar comes down to normal? You know why? Because most people don't do anything about their health, and the medical doctors don't see anybody getting better, so they know they're going to be on them. Their statements are from what they see. So in some ways you can't blame some of them because in reality people don't change their lifestyles. Well, if they don't change their lifestyles, their symptom though is going to get worse. The problem with this is that someday you're probably going to go up and then maybe be on insulin. But you know better. So sweetheart, you're going to take care of this. I have been 50-80% raw for the past month or so. Good. I'm waiting till January before I... Oh, okay, honey. I'm sorry you have to wait so long, guys. It's just been that way. That's why we're going to open up to more counselors here because there's just, you know, it's too much. We're booking now into March, and I have lost almost 50 pounds. Woohoo! In the past year. Great job on yourself. Great work on yourself. Again, adrenals, this is adrenal glands. It's why the weight in the first place, and the kidneys. That's why the blood sugar. That's why the weight. So fixing those adrenal glands, getting your kidneys to filter the lymph, you're going down the road to Wellville, darling. Need to lose lots more, so working on it. Just keep going, sweetheart. Don't think about that. Love you too. Don't think about that. Just keep thinking about health. I'm eating healthy. I'm being healthy, and one day you're going to look there and go, whoa, new body. Yeah. So good job. Good job. And watch your blood sugars because, you know, if your blood sugar is 140 or below and you're asymptomatic, meaning you don't have any symptoms, well, why would you take anything? A lot of people walk with higher blood sugars for a while they're working on it. So what? You know, it's all about symptoms and that sort of thing when it comes to blood sugar, especially in the type 2 type, which is sugar metabolism. Annie C., how can I contact you? As I saw a video of a lady with MS read out a letter. Wasn't that tearjerker? I recently became a support person for a friend with MS, and I know another on Facebook. Well, darling, that's why I put her on there. I can't stand to see people suffering. It's kind of like this blood sugar. Here, you got MS, take these chemicals and we'll just let you suffer the rest of your life because they don't know any better. We know better. We're the healers of the planet. We know better. So as healers, we're going to go after these people that are suffering. With MS, any neurological condition is suffering. Yeah, karma, but let's work karma out. Let's go through and work this karma up, get on the other side of that, and start rebuilding these tissues. You can work karma out on different levels. It doesn't always have to be physical. And I can help you do that. Or we can. Sorry, guys. Get on that raw. And whether you have brain lesions or not, upper circ, brain and nerve, you really want to get into that lymph totally, as we've discussed previously, and how do you get your lymph system moving. Don't sit around. Even if you don't have, if you have minor MS symptoms, don't wait. Don't wait until you can't walk like this poor lady. And we have a ton of them coming in here, wheelchairs, canes, or on stretchers. So you don't have to go that far. The further you take your body down, the harder it is to get back. So, you know, don't go down too far. I deleted my post because I realized that the reason I was led to you, this is Anna C. again, the first place, because I have 2 friends with MS. Absolutely, absolutely. They're doing weekly exercises to prevent falls and stuff like this, but not curative, as you know. There's nothing curative about that. Physical therapy, yeah, you really want to hit on this and go into this raw and this higher level of fruitarianism if you want to get out of that MS condition, yeah. This is neurological weaknesses, brain lesions and things like this. A lot of issues in the cerebellum, of course, with the equilibrium. And you can work on physical therapy, but clean it out. Clean out your lymph system and restore natural tissue function. Get all this inflammation out, get the adrenals popping up, more neurotransmitters, more serotonins. And you'll be walking or running. Absolutely. This lady you saw will be running before next year's up, if she keeps going. And her husband, the chiropractor, is going to make sure of it. This guy's hell-bent. I don't blame him. That's his woman. Sounds like she has multiple things going on. I don't know who you're talking about. This is Jackie Doe to Smitten. Jackie Doe, all you guys are good. You know, I really... Thanks for us all being a group and working with each other. And we need to always do it with love. Yes, if you're carrying an attitude, it's going to pull that out of most of it. You can see that. Kelly, you were carrying one more than you are now. You're getting better, sweetheart. You're doing well. But, you know, when people sense something, it's like a dog sensing prey. They're going to go after what they're sensing. And so this is all good education for each and every one of us, including Wonder Why, sweetheart, you, Kelly. I have to understand why this is happening. And this is happening to refine you, to make you stronger. Because you can't just retreat. You must be stronger. Stronger in your commitment, stronger in your knowingness, stronger in your love. You know, and that's a test for the healers too, to work with people that are hanging on to things. And as soon as they let go, we have to let go. We have to help you through these things. There's a time to be strong with someone. There's a time to give them love. There's a time to give them compassion. It's a time to put your arm around them and walk with them. Now, 5th day on grapes and herbs, and I am beginning to feed the detox. I remember feeling this way much sooner on water. Yeah, I'm glad you said that, Jackie Doe, because yes, water does feel stronger, but there's something unique about the fruits, and it's just a better detox, and I don't know, it's just between the eating and having something and the energies and the magnetics and the astringents and everything else, there is something, and I'm glad you said that. More energy, you have more energy on the fruit detoxing than the water. But it'll get you the same place, it's just not as aggressive. Keep in mind, what you're willing to do, sometimes the average person isn't willing to do. So as a healer, you've got to look at that and understand that and pick that part of yourself that had that hard time maybe at one time. Because if you get too strong as a healer and eat nothing but fruit and raw and stuff, could come out to bite you, because God has a way of balancing out that in you, you know, especially if you want to be a healer. If you walk with balance first, you'll save the butt kickings. You know, so just give your compassion and love and understand work them through it. Smitten. That's an interesting name. Oh, on one more question. My sister Felicia will not have any complications taking these herbs with medicine, right? as long as I've been working with people and their health issues, I've never seen herbs interfere with chemical medications. If there's any interference, it's simply that the body's going to kick these medicines out. It's going to kick these pharmaceuticals out of the body because, I remember this pharmacist going to jail because he was cutting chemo way down, and so it could stretch out and he could sell more chemo. And I thought, shoot, they should have given him a gold star. He probably saves lives. Instead, they put him in jail for cutting down that life-saving acid nectar that ravishes so many people. Smitten, I might add vertigo to the mix of what my sister has. Now, again, vitiligo. I mean, this is the pituitary. Vertigo, vitiligo. So you have to realize this is going up into her head there in the pituitary. So you want to get up on a pituitary glandular and really start working with your sister in the raw foods here, Smitten, and get going with that. My sister got an irregular pap smear. Okay, now this is important, Smitten. That's why I put this up front here. My sister got an irregular pap smear back and will be going to do an MRI. Now here's where the medical profession starts taking off, right here. Right here. She's going to be doing an MRI done to see if it is cancerous this Thursday. She has a background of anxiety, panic attacks, sleep apnea, depression. And when she was in high school, I remember she was some kind of cyst, I think, in her breast. She's only 28 years old. So this is for you, sis. She's Felicia. She's got sleep apnea. She has a sleep apnea machine by her bed. Okay. It would be okay, so I do not want to see her get radiation or anything like that. Already laundry list of issues. Absolutely. So, here's the gig, sis Felicia. I created the Heal All Tea for douching. Get using that right now. Start douching with the Heal All Tea. Douche at least once a night. Get in a bathtub. They'll tell you, lift your hips, make this tea, get a skin temperature, insert it. Get you a douche bag or whatever you can. Get it up in you. Hold that in there. Hold that in that Heal All Tea. And then let it go, and then put some more in there, and do that for about 2 weeks, and it should convert that cell back within the week, but it might take 2 weeks to convert those cells back. This, what's your anxiety gives you a big clue. Your anxiety is your adrenal glands.